I'm Peter Hesslein. I am a pediatric cardiologist or children's heart specialist, and I'm going to talk about fainting. The medical term for fainting is syncope, and it means loss of consciousness due to a lack of oxygen in the brain. When people faint, they are often sent to a neurologist because fainting is, after all, a brain event. Occasionally, fainting is due to epilepsy or seizures. However, far more often the cause is cardiovascular. It is the job of the cardiovascular system, the heart and the blood vessels, to deliver oxygen by means of blood flow to the brain. There are basically two ways that the cardiovascular system can let your brain down. One way is through an abnormal heart rhythm, way too fast or way too slow. Another is a sudden drop in blood pressure. When people faint because of a heart rhythm problem, they're sometimes aware of a racing heart, but more often they have no warning at all and pass out suddenly. This is a more worrisome or dangerous form of fainting and something that definitely needs to be evaluated and treated. By far the more common variety of fainting, however, is due to a drop in blood pressure, and this is almost always associated with a change in position, especially when someone is standing. The typical symptoms when somebody is fainting involve dizziness or lightheadedness, feeling hot or cold or sweaty, getting very pale, and sometimes nauseous. These symptoms can often be reversed by sitting down or especially lying down until blood flow is reestablished to the brain. Very often people with this condition can learn to recognize and manage their own symptoms and don't require any special treatment. However, some individuals have so frequent or so severe episodes of fainting that they need medication to blunt the reflexes that are causing the trouble. This condition is very common in teenage years because the nerves that control the tone of our blood vessels haven't matured. However, most individuals who develop this problem as teens will outgrow it, and they'll look back on their teenage years as a time when they used to faint but don't anymore. There are more dangerous forms of fainting, and this is what needs to be evaluated by a cardiologist, but in most cases the outlook is good.